Hey guys, this is Miss Lynn. I'm going to talk about my day today and chapter 2 of this book that I started reading last week. I hope you all are doing great. I am doing really great. I had a great day today, though it was calm and I was not too busy. But I had 30 minutes exercise today, which really helped me during my day. So I think I'm going to continue working out during the day. I think in the morning is great. I did it this morning and I liked it because it helped me during my day. So I think I'm going to be doing some exercises during the day. It was really nice. Okay, my thighs are hurting. Let's say that's part of the results from exercising. Okay, now let's get to this book, because the book is my main focus now, because I've been trying to master chapter 2. Let's see, what is chapter 2? Oh, first, I am not a teacher. I've not been to any nursing classes. I just want to do something new. That's why I'm reading these nursing books. And also, I really want to become a registered nurse. And I'm reading this RN Community Health Nursing, which is, I think, a good book as a community nurse. If I can learn some things from this book, hopefully it will help me when I go to school. So we talked about chapter 1 last time. Now we're going to talk about chapter 2. Chapter 2 basically is talking about factors influencing community health. We have factors like family and culture, social and environmental factors. We have access to healthcare and healthcare financing. Those are some of the factors that affect community health. Okay. Okay, I guess I'm going to put it that way. Okay, when we talked of then they went ahead and talked of family and cultural care. Yeah, it's just to help us understand that the different cultures and that cultural beliefs can really affect somebody's health. The way you treat somebody who believes in his culture will influence their health. So as a community nurse, we really have to understand or consider that the variation I'm sorry guys. Okay, that different cultures and that every client is unique, and we have to be familiar with people, with our clients' cultures, and we have to respect their culture. Also, we have to try to adapt to these cultures, like the way the people like their food, the way they eat, the language they speak. So these are some of the things that will help them and will help them to recover in whatever way you're trying to help them. And we also have to be familiar with, because this is about the community, we as registered nurses, in the future I'll be one. We have to understand the beliefs of a community and know how to help them better using their beliefs. We have to be aware we don't need to impose our beliefs on a client, and we should not be stigmatized. Like, we should not say, okay, these people, they behave this way, so I think these people, since maybe they are their neighbors, they're going to behave the same way like them. No, we should not do that. Or We just have to follow whatever way the person's culture is. We have to do that. And they talk about cultural assessment. The general cultural assessment parameters, we have things like ethnic background, religious preference, family structure, language, communication needs, education, cultural values, food patterns, health practices. Yeah, and the 3 ways of collecting data, the 3 steps of data collection. We collect a collection of self-identified data about the client's ethnic background, religious preference, family structure, food patterns, and health practice. That's 1. Posing questions that address the client's perception of his health needs. Identification of how cultural factors may impact the effectiveness of nursing intervention. Like if you're trying to intervene in somebody's health problems, and the person is having different beliefs or same beliefs as you have to find out. Maybe the person might not even believe in these beliefs, but then some people really believe in their culture. So if this is somebody who believes in the culture, you need to find out how their culture can impact them, so you can better help this person. And using an interpreter. Oh yes, sometimes I'm sorry guys. Sometimes you have some people, or you can go to a new community and you don't speak their language, and you need an interpreter, or somebody can come to your facility who speaks a different language. I think, yeah, it's a federal government mandate that requires agencies to have plan that will improve access to federal health care program for individuals with limited English proficiency. And also, health teaching materials should be available in clients' primary language. Like if the person speaks French and the person comes to your hospital or your facility, I think if you have if there are questions that the person needs to answer in a, I don't know, something, it should be in their language. They should be able to have questions in their language, and they should be able to understand. And also, if you need to bring in an interpreter, your client needs to approve the person, and you should consider the age, the sex, and the relationship with the client. It's sometimes not advisable to use family, as the client might not be comfortable with disclosing their personal business to a family member. But then if the client is comfortable with that, then that's fine. You can go ahead and use a family member. If not, please provide one. And also this person you're providing as an interpreter should have some knowledge of health related terminologies, because there are a lot of them. I don't know any yet. Areas of self-assessment. As a registered nurse, you also have to assess yourself. If you want to help this person culturally, are you aware of your own culture and views about others' culture? Are you able to perform a cultural sensitive assessment? Do you have the knowledge necessary to develop cultural appropriate nursing interventions? What is your goal in learning about diverse population? All those questions, I don't have answers personally, but I'm going to be working on these answers now to see what I can get and how I can help myself to better help clients, if all patients. Coach, the nurse should address clients by their name unless they give you a different name. Also, I think addressing clients by their name, it gives them some awareness that you know them. You're really concerned about them. Like, oh, you call me by my name. Oh, wow, that is great. Thank you. Like, instead of coming to say, oh, hey, or baby, I don't know, maybe they might not want you to call them baby, or they might not want you to call them sir or whatever. It's preferable to call them by their names unless they give you a different name. Also, when you're talking to your clients, you should always present yourself, and you should tell them why you're there, what you're going to do, or explain what you're going to do, and you should be honest about what you're doing and everything you're going to do. You should use their language. If you cannot use their language, you should be sensitive to their language by bringing maybe an interpreter or something. You should incorporate clients' preference and practices into care when possible. Encourage clients to ask about anything that they may not understand. Respect clients' values, beliefs, and practices. That's what this chapter is all talking about. Show respect for clients' support system, like their family that's there with them. And remember, there were 3 factors that influence community health. One was cultural and family, I just talked about. So we're going to go to number 2, which is environmental risk. We have we have risks like toxins, air pollution, and water pollution. All this affects the community. As a nurse, your role in the environmental health is to facilitate public participation, perform individual and population risk assessment, implement risk communication, conduct epidemiological investigation, participate in policy development. All that to help. Assessing of environmental health. There's this Moniac, I think that's what it is pronounced. Monenic. I don't know. I cannot pronounce it. I don't know the right pronunciation. But then it's this letters that has been developed to represent a bunch of things, and the words they made it into 2 words. I prepare. This I prepare are different things that help you to assess the environment. I is for investigate potential exposure. You have then P, present work, for exposures, use of personal perspective, equipment, location of materials, safety data, shades, blah blah blah. You have R is for residents, the age of home, heating, recent remodeling, chemical storage, water. All those affect the health of the clients, as a result the health of the community. Environmental concern, the air, the water, the soil, industries in the neighborhood, waste, site, and landfill nearby. All those affect the environment. Past work, were these patients exposed to some risk chemicals, riskful chemicals, or I don't know, whatever could be of harm to the client. A is for activities, what they like doing, gardening, fishing, swimming, all those things. From knowing those things, it will help you to be like, okay, maybe if this person likes swimming and they come to you that too cold or something, I guess you might be like, okay, maybe because they were swimming, or swimming might affect them having this cold. I don't know. Like I said, I'm not a teacher. I'm just reading and trying to create some scenarios to understand what is in this book. R is for referrals and resources. You have E is for educate. Educate the population about the risk and educate them about prevention method, and educate them how to follow up, help them to follow up with you, and you to have to follow up with them. Key questions for environmental health history. Housing. What is the physical condition of residents, age, location, school, daycare, or work site? What are the occupations of household members? Is tobacco smoke present? Are there any recent home remodeling activities? All this is just talking about the ways of assessing the environmental health. These are some of the questions you can ask that can help you to better understand how to assess the way the environment is affecting that community. And is there any recent exposure to chemicals or radiations? Are pets present in the home and are they healthy? Has there been any lead exposure in oil, paint, craft, lead, pottery, or dishes? What is the source and quality of drinking water? Recently, I was hearing in the news that a lot of places here, I don't know where exactly here in Columbus, where lead was in a very high amount in the water, and that can affect especially children. It's not good. Lead is not good for the human body. So we have some areas that they still have water affected with lead, and that is not good. Where do children play? Is there any hazardous play equipment or toys? Okay, those are just some of the questions you can ask the people in the community, or you can ask your clients to better understand how to help them. We have national goals, national healthcare goals. Oh, so there's some national healthcare goals. We have goals to reduce toxic emission, waterborne diseases, outbreaks, blood lead level in children. Oh, okay, yeah, because that is not good. Indoor allergen levels, exposures to chemicals and pollutants. Those are some of the things that I don't know what to say. The administrators, or I don't know, they're trying to reduce, but then as well they're trying to increase some things that can help. The use of alternative modes of transportation for work, numbers of days that beaches are open and safe for swimming, recycling of municipal solid waste, testing for presence of lead-based painting in pre-1978 housing. There's this app Zillow where they sell houses, and I always used to, when I'm checking, and I was looking some of the houses, and most of the time I'll see them asking, okay, was this house built prior to 1978? And I was to myself like, why are they always asking, was this house built before 1978? But then reading this chapter, that has helped me to understand that houses built before 1978, they had high risk of lead in the system, or I don't know what to say, but then something like that. So guys, if you want to buy your house, make sure if your house was built before 1978, make sure you check for lead, maybe in the water, or I don't know where else it could be possible, but then your retailer should have more information. Your real estate assistant. Okay, the 3 ways of intervening in environmental health nursing. You have primary prevention. secondary prevention and tertiary prevention. You have primary prevention in the individual and in the community. As an individual, you should educate individuals to reduce environmental hazards. Community, educate groups to reduce environmental hazard. Okay, that's already personal. Advocate for safe air and water. Like if there was a company that wanted to build in this community and you know that their end product or something about that company is going to cause problem to the community, to the air that these people in this community will be breathing, as a registered nurse, you should be able to have, you should help the community, you should advocate for them, or they should be able, you should help them to fight that. You should support programs for waste reduction and recycling. You have secondary prevention as individuals, survey for health conditions that may be related to environmental and occupational exposures. Obtain environmental health histories of individuals. I think ways of obtaining this answers will be talked in the previous chapter. I read a little, but I'm still going to read more. Survey for health conditions that may relate to environmental and occupational exposures. Okay, it's like the same thing as a community also. Then tertiary prevention for individuals. Refer homeowners to lead abatement resources. Oh, like I said, if you want to buy your home, try to check it out. Educate educate asthmatic clients about environmental triggers, things that can trigger their asthma. As a community, you still emphasize on the same thing, and you support cleanup of toxic waste sites and removal of other hazards. Okay, access to healthcare. Oh, access to healthcare is the third factor that influence community health, because healthcare is a big thing. You have barriers like inadequate healthcare insurance, inability to pay for healthcare services, language barriers. Yes, language barriers can really make somebody, like, can really cause a big problem, because if the client does not understand how to manage their treatment, then there will be a great problem. If you as the nurse, you don't understand the client complain on what is wrong with the client, and you go to the doctor with wrong information, and the doctor gives wrong diagnosis because you didn't understand, then that's really another trouble. Oh my gee, 23 minutes already. Okay, no, I'm just going to stop. I didn't want my videos to be too long like that. Oh gosh. Okay, in this third factor, you have healthcare organizations like International Healthcare, World Health Organizations, WHO, who you have federal health agencies. They talked about Medicare and Medicaid. They talked about other agencies. You have state health agencies, local health department, private funding like health insurance, employer benefits, and managed care. Okay, that's all about chapter 2. And I finished after reading this chapter. I went through and I went through the questions. I had 3 on 5. That is great. Last time I didn't have that much, but then I think I I learned a little more from this chapter than the previous one. I like that. I hope you all have a good night or good day whatever time you're watching this video. I'm sorry guys, it's too long. I didn't know it was this long. I was busy reading and talking. Okay, love you all. Have a good evening. Bye.